Now, as a quarter of the world's population is put on lockdown, proposals for Ghana to do the same have been met with mixed reactions. The latest to have waded into this debate is a research scientist at KNUST's Department of Medical Diagnostics. Now, he argues that government should rather identify and lock down the epicenters in the country instead of a nationwide lockdown. Already, the country has recorded 68 confirmed cases with 4 deaths. Actually, that number has increased since then. It's over 100 confirmed cases now. But it is time for a lockdown. Is it time for a lockdown? Sorry. Here's a report capturing all of the arguments from experts on whether or not a total lockdown is necessary.
Is government considering a lockdown? Let me say that all options are on the table. All options are on the table. Government continues to receive advice which is subjected to analysis by the
Information Minister Kojo Nkrumah announcing government will only take action after experts speak. But the health experts are divided. The first to have called for a gradual lockdown is the senior research fellow at Noguchi Memorial Institute for Medical Research, Dr. Kofi Boni.
We can do a gradual looking at essential workers, maybe working electricity, water and all that. They can be going. And even that one, we can cut down the numbers because people are taking public transport. That is the issue. I'm thinking we can do it gradually, this lockdown, starting with essential workers, those that we really need. They should go. And those that we can do without for a period of time should stay at home.
The Ghana Medical Association agrees with Dr. Boni, except they want it to be taken with immediate effect.
Now, the question we should ask ourselves, do we want to go to the levels of Italy, Spain, and the likes before we try to break the chain of transmission, or we do it now and save our healthcare system? We have a system or a health system that is not as robust as that of others. We also are not in control of medical supplies because most of them are actually brought into the country from elsewhere. And at this crucial point in time, where virtually every country is actually trying to mobilize them all that they can to fix their own COVID-19 problems, it has become imperative that we take these measures to contain the spread of the disease now.
Again, another aspect, this time a virologist with the Kumasi Center for Research into Tropical Medicine, Dr. Michael Owusu, says the approach proposed by the GMA is wrong.
If you close the country down and you don't have variables to measure the success of your close down, then you cannot predict when to close down, how long to close down, and what will be the end result of this. So for me, the first is that you must know the exact burden of the disease at the community level. It is the community cases that sparks outbreak. So once you understand the burden of the case, you can lock it down. And once lockdown is ongoing, you still test. You still do mass testing. Then you expect that the cases that report to your hospitals or the number of tests will tell you the prevalence change after lockdown or within lockdown and before lockdown is what will tell you that you have been successful.
These are all health experts. But they are not the only ones making arguments. Community NGOs are also kicking against a total lockdown as they fear the slums will be greatly affected.
Lockdown? Well, yes, the best approach to fight the coronavirus head-on, according to some experts.